Hello everyone, I am Dr. Preeti Sharma, Senior Consultant Pediatrician at KIMS Cuddles Hospital, Kondapur, Hyderabad. I will be talking about the warning signs of COVID-19 in children. So if there is someone in your house who has been diagnosed with COVID-19 or your child has been diagnosed with COVID-19, there are certain signs and symptoms which you need to be aware of when you need to rush to the hospital immediately. Nothing to be scared, nothing to panic about. 90% of the children will recover on their own at home with just symptomatic treatment, but you should know when it is an emergency. If the child has very high fever, you are giving paracetamol, you are doing sponging, still the fever is just not going down. The child is very lethargic, child is not eating well, child is just going on sleeping. Child is having fast breathing, the rate of breathing is faster than usual. The child has chest retractions, the space between the two ribs is going inside, that is known as chest retractions. In Hindi we also call it pasli chalna. If child has any of these symptoms, any abnormal movements, any child with high fever can develop fits or abnormal movements. So similarly in COVID, if your child is having a staring look, eyeballs are turning upwards, hands are shaking abnormally, tightening of the hands, in that case you need to rush to the hospital immediately. Also, as most of you are aware, you are going to be checking your child's oxygen saturation using a finger pulse oximeter. So if the oxygen saturation is less than 94%, then you need to rush to the hospital. One thing that you need to keep in mind while checking the oxygen saturation is that the child is not moving his or her hand. Especially in small children, because the fingers are small, the finger pulse oximeter does not fit in properly. So don't worry, for a child less than 1.5 to 1 year, even if you don't get a proper reading, but otherwise your child is fine, then it is okay. For older children, make sure you check this reading when the child is sleeping or at rest. Make sure that you put the pulse oximeter in the middle finger, which is the biggest finger for children, and the pulse oximeter should fit in snugly. You can see a waveform in some pulse oximeters, so make sure that you see a proper wave being formed for 30 seconds to 1 minute. Then you consider that reading to be correct. So if that reading is coming less than 94%, then please go to the hospital. If you find that your child's hands or lips are turning bluish in color, child is going on vomiting, even if you give the vomiting medicine, still the child is not able to take in anything, not even liquids like milk or soups or other liquids. Child is having persistent watery loose motions. There is blood in the motions. If the child is not passing urine at least every 4 to 6 hours. In younger children, sometimes if the child is just going on crying, no matter what you try that the child is crying, that could be a sign of low oxygen levels. Child complaining of significant chest pain or chest discomfort. In this case, you need to rush to the hospital immediately. Please identify a hospital in your area which is taking pediatric COVID admissions, because many a times a lot of time is lost in just searching for the appropriate hospital. We at KIMS are taking all COVID pediatric admissions, including newborns. So in case your child has COVID, please keep these symptoms in mind, and if any of these are there, just go to the nearby emergency. Thank you.